Hi everyone, I'd like to cover the topic of breast surgery. Number one, you need to set realistic goals. Things that you need to consider are your body size and shape, your current breast condition, what size you're starting out with, and realize that the results may not be symmetrical. They're sisters, not twins, and so you need to consider that as well. It's best to find pictures that define a range of target results that you're interested in instead of one specific person, say, a celebrity, and say, I want to look like that. And the reason for that is you need to trust Dr. Pusti to make the final decisions during surgery based on what he's seeing and maybe some constraints that are visible during the surgery, and also considering safety and practical issues. So all of those things should be discussed up front. And I think if you have a range that's reasonable, I think that will be part of your realistic expectations. Talking about breast lift with or without breast augmentation, the results can be different than a standard breast augmentation. You really should look at pictures of patients that are starting out at the position that you are to get an idea of what their results look like and what your results may be. Sometimes there's 2 steps required. It really depends on what the starting point is and what needs to be done to do the breast lift part. That you may have to actually have a surgery and then a revision after that. So after surgery, the breasts are not going to be in the final position. You'd be told that up front that it's going to take time for them to wind up in the final position, and that you're going to have to do some things like massage daily or on some schedule that the office tells you. And so don't get excited if on day one you wake up and things aren't exactly the result that you want, because it's going to take time for that to move around. Allow time for recovery. As far as lifting, reaching, and physical activity, these are important because everyone's using their arms normally, and that you're going to have to restrict yourself up front according to the instructions that you're given by the surgeon and by the office. So just build that into your plans for your activities following surgery. Also remember that your emotions are going to follow a roller coaster. You're going to get very excited in the beginning, and then you might have a little anxiety before the surgery, and then your recovery obviously is going to go through a process where it gets better over time. So you're going to be communicating with the office staff and the surgeon after surgery, and be sure to bring up any questions that you have or any concerns that you have, so that you're comfortable during recovery and you're not stressed out by not understanding what's going on. So important thing is to get organized, make your lists, ask your questions, and be confident in your recovery, and hopefully it'll make it that much more enjoyable. Good luck.